like another antiparasitic, fenbendazole or mebendazole. Now, this is a different family of antiparasitics than ivermectin. Fenbendazole was actually interestingly discovered by a terminal cancer patient from Oklahoma, Joe Tippins. And Joe Tippins had stage 4 small cell lung cancer, which is one of the most aggressive cancers known. And he had stage 4 small cell lung cancer diagnosis, terminal diagnosis, and I believe he was put on a trial of Keytruda at the time. And
is that a regular cancer drug?
It is a regular cancer drug, yes. And sort of what they call an immune checkpoint inhibitor.
Yeah.
And so he was put on Keytruda, and he tells the story later on that everybody on that trial died. He was the only one who survived. And he tells the story of how he had a friend who was a veterinarian who said, look, there's this parasitic drug, this dog dewormer called fenbendazole. It's been accidentally found to have anti-cancer properties in mice. It's cheap. It's safe to take. Why don't you try it? And the story goes that, he tried this dog dewormer, dog medicine, I guess you could say, and he cured his stage 4 small cell lung cancer, which is completely unheard of. I think he was given a survival of less than 1%, sort of a 5-year survival of less than 1. And he's still here to this day. 7 years later, he's cancer free with a stage 4 small cell cancer diagnosis. And so at the time, he would actually go on news shows and talk about his experience of trying fenbendazole, which was not FDA approved for use in humans, and how it cured his or he believed that it cured his stage 4 cancer. And then, I look into that research, that body of research. See, again, there's a ton of preclinical research on fenbendazole. And there's now been cases published by Stanford University Medical Center of 3 patients who cured their stage 4 cancer with fenbendazole. And the Stanford group looked into it, analyzed it, monitored these patients. These patients had all failed 3 or 4 lines of chemotherapy. They were terminal. They took fenbendazole, and they are now cancer-free. And the Stanford group published this. Now, the Stanford group itself, they were not allowed, the researchers were not allowed to recommend that drug, fenbendazole, because it's not FDA approved. But they were at least, this is what I love about science, is that they saw something fascinating. They saw something that they thought other doctors and scientists should know about, and they published it. And they published this case series. You had actually talked about this. You had talked about this paper from 2021. This series of 3 people who had cured their cancer with fenbendazole. And so there is an FDA-approved version of fenbendazole called mebendazole. It's structurally almost identical. There's 1 atom difference between fenbendazole and mebendazole. Mebendazole has been approved by the FDA as an antiparasitic drug for use in children and adults. And so it has an incredible safety profile, very safe to use. And mebendazole actually has a dozen clinical trials in which it's being looked at as a cancer agent, as a repurposed drug for cancer. And so I think because of its status as an FDA-approved drug, there was much more willingness in the oncology community to do trials with it. And so there are trials in adults looking at colon cancer and various prostate cancer, and there's also trials in children looking at brain cancers with mebendazole. And again, this is an antiparasitic drug that has a dozen mechanisms of action. One of the fascinating mechanisms of action in cancer is that it blocks glucose transporters on cancer cells. And so it sort of starves the cancer cell from being able to use glucose as a fuel source.
Specifically in cancer cells and not on normal cells.
Yeah, exactly.
Glucose transporting in cancer cells. That's amazing. So there must be something biochemically different about the glucose transporter in cancer cells compared to ordinary cells that it's able to specifically target.
Exactly. And what's fascinating about these repurposed drugs is they are very specific to cancer cells. They are able to somehow identify a cancer cell from a normal cell. And this has been studied in ivermectin as well, is ivermectin is actually able to identify lymphoma cells and act on them. And it's able to also identify normal cells, and it doesn't have that same effect on the normal cells.
It's what we call a magic bullet.
it is absolutely fascinating.
Yeah.
And I encourage anyone, look into the preclinical research. It is absolutely fascinating. And